The COVID-19 pandemic in Australia is part of the ongoing worldwide pandemic of the coronavirus disease 2019, COVID-19, caused by severe acute respiratory syndrome coronavirus 2, SARS-CoV-2. The first confirmed case in Australia was identified on January 25, 2020, in Victoria, when a man who had returned from Wuhan, Hubei Province, China, tested positive for the virus. Australian borders were closed to all non-residents on 20th March, and returning residents were required to spend 2 weeks in supervised quarantine hotels from 27 March. Many individual states and territories also closed their borders to varying degrees, with some remaining closed until late 2020, and continuing to periodically close during localised outbreaks. Social distancing rules were imposed on 21st March, and state governments started to close non-essential services. Non-essential services included social gathering venues such as pubs and clubs, but unlike many other countries did not include most business operations such as construction, manufacturing and many retail categories. The number of new cases initially grew sharply, then leveled out at about 350 per day around 22nd of March, and started falling at the beginning of April to under 20 cases per day by the end of the month. A second wave of infections emerged in Victoria during May and June 2020, which was attributed to an outbreak at a Melbourne quarantine hotel. The second wave, though largely localised to Melbourne, was much more widespread and deadlier than the first. At its peak, the state had over 7,000 active cases. Victoria underwent a second strict lockdown which eventually lasted almost 4 months. The wave ended with 0 new cases being recorded on October 26, 2020. Further cluster outbreaks occurred in late 2020 and mid-2021, with several brief snap lockdowns announced in certain states to contain their spread, particularly as novel variants of SARS-CoV-2 arrived in Australia. In response to an outbreak of the SARS-CoV-2 Delta variant during June 2021 in New South Wales, almost half of Australia's population and most major cities were in lockdown from early July 2021, with the outbreak continuing to worsen to new record daily cases into August. In late August to mid-September 2021, Victoria had its first 9 deaths since late October 2020. As of September 28, 2021, Australia has reported 102,723 cases, 25,486 recoveries, and 1,278 deaths, with Victoria's second wave accounting for about 80% of fatalities. No deaths from COVID-19 were recorded in Australia from December 28, 2020 until April 13, 2021, when 1 death occurred in Queensland. There were then none until 10 July in New South Wales, NSW. Deaths there continuing into September 2021. As of September 28, 2021, at least 331 NSW residents had died since the June outbreak of the Delta variant in Sydney. The stated goal of the National Cabinet is suppression, as opposed to elimination, meaning continually trying to drive community transmission to zero but expecting that new outbreaks may occur. This is in contrast to the mitigation strategies implemented by most other nations. Compared to other Western countries, notably the United States and European countries, Australia's handling has been praised for its effectiveness, but has been criticized for its curbing of civil liberties. Distinctive aspects of that response included early interventions to reduce reflected transmission from countries other than China during late January and February 2020, early recruitment of a large contact tracing workforce, comparatively high public trust in government responses to the pandemic, at least compared to the US, and later on, the use of short, intense lockdowns to facilitate exhaustive contact tracing of new outbreaks. Australia's international borders have also remained largely closed, with limited numbers of arrivals strictly controlled, for the duration of the pandemic. Australia sought to develop a Bluetooth-based contact tracing app that does not use the privacy-preserving exposure notification framework supported natively by Android and Apple smartphones, and while these efforts were not particularly effective, QR code-based contact tracing apps became ubiquitous in Australia's businesses. These apps, which are effectively required by state governments, give government health departments the ability to reconstruct the presence and possible contacts of anyone carrying a mobile telephone handset capable of checking and using a QR code at the time of visiting shops, bars, restaurants or similar venues, generally for 28 days after the visit. Furthermore, venues are required to provide alternative contact registration for anyone unable to use the app. The nationwide vaccination program began with the first doses of the Pfizer COVID-19 vaccine being administered in Sydney on Sunday, February 21, 2021. The slow pace of the country's vaccine rollout, which fell short of its initial targets, has been criticised. The pandemic has impacted Australia's economy, causing its first recession in 30 years, with the arts sector being particularly hard hit.